and we can get started.
Perfect. Thank you everyone for joining after 4th of July. I hope everyone had a great time. So I thought this was a really excellent topic, especially, I guess I can't say post-pandemic, but getting behind everything that's gone on the last couple of years. I'm sure a lot of you have found yourself in the same position, caregiving for a family member or a really good, perhaps a friend. And so I would like to go through what the statistics look like, as well as what caregiving or care partnering actually means. I want to explain that a little bit later and help you understand what kind of options are available to you. Not just a family, but today we're going to be cuddling caregivers because it's a very important, unfortunately, sometimes it feels thankless, but it's a very important position a lot of us find ourselves in, not just adults, but children as well. So we're going to go through that. We're going to find a statistic, silent cost of caregiving, because there's a huge cost that it's not, there's no dollars attached to it. Understand the benefits to the patients with familial care partnering, and where to find resources for caregiving. Next slide. Okay, so the real cost of caregiving and the caregiver benefits. First, let's redefine this term caregiver. This is something I had to do when I was taking care of my husband. This change in perspective can go a long way in the quality of caregiving, as well as your attitude and of you, as well as your person who's benefiting for your caregiving. A caregiver is generally a paid or unpaid member of a person's social network who helps them with activities of daily living, no formal training necessarily, and may not know the person. I try to look at this from a family perspective. Sometimes you may pay someone to come in. They don't really, a lot of times they don't really know who that patient is, who that person is. So I want to try to refer to person. A care partner, an agreement between the person and a chronic condition and their loved one to be partners in care as best they can, to help each other with the health and wellness and caring for each other. Know that person knows the person they're taking care of, and the caregiving is when needed, not necessarily all the time. Now, when my husband was ill, and there was times where he definitely needed someone to help him. Sometimes he was bedridden. Other times he was up walking, working, doing what he wanted to do. So it's a understanding of what that person, who that person is, what they used to be like, and the choice to take care of them. I wouldn't have wanted to be anywhere else with my husband. As difficult times as we went through, that was the best place and the most rewarding position for me to be in. Next slide. So what does caregiving look like in the United States? So we're going to go back to like 2020, and this is pre-COVID for the most part. Overall, more than 1 in 5 Americans, 21.3%, are caregivers to adults and children in the past 12 months. I'm sure that's probably higher. That's ARP 2020. It's probably a whole lot larger than that. 19.3% of the population are caregivers. 47.9 million people. That's a lot of people. 24% caring for more than one person. I can't imagine how difficult that must be. Caregivers report that the recipient of their service have greater health and functional needs, and often with more than one reported illness. Increased need with aging population, we know that's going to be ongoing, and lack of affordable resources, and most family caregivers receive no financial support whatsoever. That is a very difficult thing to put your arms around, because when that person needs help, they need help. And a lot of times caregivers will be leaving their jobs. Next slide. Women are more often caring for more adults, 27% versus 20% for male caregivers. That's not surprising. If we look in nursing homes, a lot of the people there are women. They're older, and there are very few men, because unfortunately men, their lifespan still has not caught up to women. Those caring for a spouse tend to focus solely on their care, not on their own care. 2 out of 3 care recipients are women, and 4 out of 10 are men. Averaging duration of caregiving is 4.4 to 5 years. 3 out of 10 provide care for more than 5 years. How caregiving affects a spouse options to review. Who will care for the caregiver? That's huge. Where do you find resources and get help? And who are the caregivers? Children are not immune to these responsibilities. Unfortunately, more and more children are becoming caregivers themselves. Next slide. So there's a silent cost to caregiving, and I can totally appreciate this. I lived it. There's a loss of income because I left my job at the height of my profession time to stay home with my husband. There's a loss of savings as a result. I could no longer save toward my or our retirement or any other things we had going. There's a sense of guilt, a guilt for of leaving your job, a guilt for spending more time taking care of a person than with your children, especially if your children are younger. My kids were in high school and they need to be transported to their functions. So there's a lot of guilt that you gotta manage. There's a lot of frustration, not being able to do enough. You never feel like you're doing enough. There's fear of the uncertainty, not knowing what's going to go on. Again, there's the uncertainty. Desperation. I can't tell you how many times I was desperate for someone to come in and help me, to give me a second opinion on what I was doing. There's a financial and emotional stress. There's loneliness. In the middle of the night when things seem to be going bad, or you don't know what's going on and you're watching, and can be very lonely. Sense of isolation, how that can affect you psychologically, despair, anxiety, and unfortunately, because a lot of caregivers do not take care of themselves, generally there's a loss of their good health. Next slide. But doing all of this, there is a sense of purpose. When you look at caregiving as not being a job, but as a sense of cooperation, and it's a combined sense of helping. It turns it into something more than just a job, more than just a thing you have to do every day. 61% of Hispanics report, and 59% of African Americans more often report that caregiving provides them with a sense of purpose, despite performing more hours of care and care tax, resulting in higher intensity care situations compared to 46% white and 48% Asian caregivers. African Americans and Hispanic caregivers report not having as much emotional stress. Perhaps it's cultural. Though the reasons are unclear, I said it could be cultural, expectation to care for one's own family or community, which can buffer some of the emotional stress. In addition to this, I would probably put forth that a lot of those communities are usually closer knit communities, and they don't live as far away from family. You have a tendency to stay close. So that's probably why African Americans and Hispanic caregivers, it's just something they do. They take care of one another, and they don't travel or as far away from the core family. Next slide. So some of the financial situation of caregivers. Many caregivers leave their job to take care of their loved ones. I had to do that myself. This move, especially when done during the height of a professional and financial career, can cause a negative domino effect. Not just for the period of time you're there, it can go for the rest of your life. It's amazing. In women, I said they were the ones who take care of more often the caregivers. If they're leaving their job to take care of a person, a spouse or a loved one, a lot of times they've left their jobs to take care of children, or didn't enter the job space because they were taking care of children. So they come into perhaps caregiving later on in a more negative light as far as financial reserves, because they don't have the time in the workspace to save for their retirement or for family needs. And so it becomes more of a long-term domino effect on savings. There's a possible loss of insurance if that person would have to quit their jobs to stay home with the person they need to take care of. Medical insurance, life insurance, and disability for the employee. There's a loss of savings program that I mentioned earlier, funding IRAs or 401ks, leading to less income in retirement. And it could also increase your debt, especially credit card debt. A lot of people end up going through savings, and they end up putting a lot of their medical needs or regular expenses on their credit cards. Getting a credit card debt, that's going to affect your credit, inability to possibly get loans or to do other things you need to do later. So there's usually a high, it's usually a high stress position to be in because you're managing not only financial, you're managing your emotions, the emotions of the person you're taking care of, plus all the other things that come into play that seems that you're not aware of until you're in the middle of this situation. Next slide. So with all of this, in the light of all of this, a caregiver, who's going to take care of the caregivers? They're suffering from, like I said, emotional, psychological fear, anxiety, financial anxiety, all of this stress. And unfortunately, caregivers do not take care of themselves. They're putting everybody else in front of them. So, and then why is it becoming more and more difficult to find care? Yes, you like to spend some time away, do grocery shopping, do some things you have to do, but it's very difficult to find someone to come in to take care of you. And the cost is usually very exorbitant. So the shift to community-based care is one of the reasons, settings rather than a traditional residential settings. And on top of that, a lot of those settings are very expensive. In the state of Kentucky, the average cost of caregiving, if you're going to go into a care assisted living or nursing home, that could be $57,000 a year. How many people have that kind of money sitting aside? And the average time spent in a setting like that is 5 to 7 years. That is a lot of money. So 1 in 5 caregivers report high financial strain as a result of caregiving. That's 18% of the people who are caregiving. 4 in 10 have experienced in their caregiving at least one financial impact, losing a job, losing savings, and this is as a result of caregiving. 3 in 10 have had to stop saving as a result of caregiving. That's 28%. If they're stopping saving, how's that going to affect them and their families going forward? 1 in 4 have taken on more debt as a result of caregiving. That's 23%. So if they're taking on more debt, they're saving less, they're not making the income because they're saving home. You can see how the financial stress just compounds one on top of the other. Next slide. So the erosion of caregiver savings, 22% of caregivers have used up savings and 12% used up long-term savings as a result, such as going through their IRAs and borrowing out their 401ks. That alone causes some additional costs because if you're not retirement age, borrowing out of IRAs or 401ks becomes another tax burden. And you may have penalties associated with that, 10% penalty to take it out, and then you have to pay taxes on everything you've taken out. So that, again, exacerbates your savings, the lack of income, everything else. So taking those things out will be eroding your years of potential financial gains. Additionally, possibly incurring stiff penalties and additional tax liabilities. 2 in 10 have left bills unpaid or paid them late, again, affecting your credit. 19% report that, hurting their credit. 15% borrowed money from family or friends, and you know this is not something that could be done all the time. And it's not sustainable. 1 in 10 have been unable to afford basic living expenses like food. This burden has become more dire as a result of the recent inflation. Unfortunately, this financial burden is more prevalent in poor communities and people of color. Unfortunately, because their economic stress they may have already encountered, this becomes even more exacerbated. Next slide. Again, who will take care of the caregivers? What is their impact on their jobs or professions? If you're out for a period of time, a lot of times you've lost the skills. You may not kept up with some of the skills that are needed to stay in your profession. So they may have to go back to school. So there's a whole lot involved in that. According to a report, 6 in 10 caregivers continue to work while caregiving at 16%. That is huge. The majority, 61% of those people have also experienced at least one work-related impact, such as going in late, missing days, leaving early, or taking time off to support recipient care, 53%. Can you imagine the stress on that, having to leave early to take someone to doctor's visits, persons in the hospital, taking time off for that? You know, then the fear of losing a job that comes into play. A lot of people retire early to be a caregiver, leaves the financial strains high. Again, leaving your job early. You don't know how long this caregiving is going to go as well. Next slide. So caregiver concerns, if you're a caregiver, you have a lot of them. You could probably get out a notebook and fill it. The impact of disease and illness, especially in long-term illness, can ripple beyond the caregiver and the recipient. Sometimes other members of the family or community may be called on to carry out tasks. And I encourage you, if you can find family or friends or neighbors that can do some of those tasks that free you up a little bit, it's well worth it. According to the AARP report, up to half of caregivers rely on others for help. That's 53%. These can include children in the home, and it's unpaid help. 14% of caregivers who rely on additional help say the help comes from children under the age of 18. Can you imagine the burden, the financial burden on the families, as well as the emotional burden on children, especially in the last 2 years when there's a lot of emotional strain on children being out of school as a result of COVID? There is so much strain out there. There's such a need for additional caregiving and additional resources for caregivers. Next slide. Many report, these are caregivers, that a lot of their time was spent on managing medical bills and insurance. Where can they get help? There are organizations that can help. If you're dealing with questioning medical bills, again, on one of our financial page, we have Co-Patient. It's an excellent organization that helps with medical bills, making sure they're right, and then fighting in your behalf to get those things reduced or taken care of. Seek out nonprofit organizations that can help assist with medical bills as well, especially when appeals need to be done. They are timely. There's a time on those appeals, and you have to make sure they're done correctly. Determine if more telehealth appointments are available. That prevents you from having to go out of the house, saves you on gas, saves you on time. And especially if it's not something that's related to having to get labs or things like that. Telehealth appointments are huge, but they're not going away. They became very popular during COVID, and they're not going to be going away. Review your insurance to determine if any services are available. There are some insurance plans that can help pay for some care. Look at it. If you have long-term care insurance, you forgot about, may have been through your job or through an organization. See what they offer. And sometimes it's not just for that person. It may be for partners or spouses, where they can share this long-term care expenses. If skilled nursing is needed, long-term care insurance can be used in the home as well as in skilled facilities. Review the policy for all of the benefits. Next slide. Respite care. This is an area that a lot of people forget that could be available to them. Respite care provides short-term relief for primary caregivers. It can be arranged for just an afternoon or for several days or weeks. Care can be provided at home or in an adult daycare center. Adult day center. This service is very underused. 38% of caregivers say it would be very helpful, though only 14% of caregivers use this service. There's things like Angel Care. If you haven't heard of Angel Care, it's a wonderful, wonderful service. Look into these things. You might be able to find it sometimes. Your Medicare, Medicaid, or state or federal programs may help you take care of some of the costs for these things. Technology could help caregivers through only 53% report using technology. These tools can help with caring for recipients' finances. Many report that technology is too complicated to use. If you call your local library, there is a lot of resources and classes they give to help you use technology, whether it's telehealth, whether it's getting online, setting up some kind of budgeting, or helping you navigate through insurance or bills and things online. There are a lot of resources out there, and there's people who will be willing to help. Call your local library. They'll be able to direct you to resources. Next slide. So access to respite care. Services are charged by the hour or by number of days or weeks that services are provided. And the prices can change depending on where you live. Most insurance plans do not cover these costs. There are some that do. Medicare will cover most of the costs of up to 5 days in a row of respite care in a hospital or skilled nursing facility for hospice care. Now, if you're in a hospital and they recommend you had to go for rehabilitation in a skilled facility, a lot of times your Medicare will pick up a lot of the costs for that. Medicaid may also offer assistance. And remember, Medicaid can be different depending on what state. Some states have additional resources for Medicaid recipients. So call your state and federal resources to find out what's available to you. You might be surprised at what's available. You must pay all costs of the things that are not covered through your insurance. Next slide. So don't forget FMLA. So FMLA is also underused. FMLA can be used by working spouses to help care for spouses at home. Up to 12 weeks, 10 states offer paid time off, which is California, Colorado, Connecticut, Massachusetts, Maryland, New Jersey, New York, Oregon, Rhode Island, and Washington, and the District of Columbia. So these all actually offer paid time off. FMLA, the traditional FMLA does not pay for that. It's just 12 hours a week. Remember, this could be broken down. It doesn't have to be done all at one time. It can be broken down in days over a period of time. So while FMLA guarantees the employee unpaid leave of 12 weeks over a 12-month period, the paid family leave provides up to 6 weeks of paid leave in a 12-month period. Paid family leave does not guarantee a leave. It's based on what your employer offers you. Also, it does not guarantee your job. You may come back at a different job, but also remember, FMLA, a lot of jobs require you to be there for 12 months or 1,250 hours put in before you can actually put in for FMLA. Check your benefit program through your job. You can opt into home and community-based service programs. Look into those. There are a lot of great programs out there that are locally based. Determine if your loved one is eligible for veterans aids. There are a lot of resources available to veterans that you would not normally have. So please call and find out about those, and some of those are paid. Determine if your family is willing to pay you for your caregiving time. Case in point, my mother lived in South Carolina, 8 children. We lived all over the country, and we used to provide support with all kinds of things. We picked up all of her bills, her mortgage. We had a couple of my family members, my 2 sisters that live close, would spend time taking care of my mother, and we would pick up a lot of the costs for that. So there's things that can be done to help take care of that person you need to take care of. Next slide. So how do you become a paid caregiver? I hear this quite often. You need to determine your eligibility for Medicaid self-directed service program. States have several options for providing Medicaid enrollees with the option to self-direct Medicaid services under the state plan and waiver programs. This is very important. I didn't even know about this until the last couple of years. When enrolled in one of these waiver programs or other self-directed options, program participants may use their allotted budget to hire and pay for caregivers. And you can use that budgeting over a period of time, whether it's 1 time a week, 2 times a week, whatever is allotted in there in that budget, you can hire somebody to take care of you. Again, you got to find out whether that spouse is eligible to be paid for under that Medicaid service program. To determine your family member's eligibility, again, for services, contact your local Medicaid office. They'll be able to tell you whether they can pay that spouse or that family member to take care of you versus someone coming in from an organization to help take care of your family member. Next slide. The programs that compensate family caregivers differ from state to state, and in some cases from county to county. So again, call your state, federal, county organizations, local organizations to find out what's available to you. Not all states make this option, and some states have restrictions on family members that may be hired as caregivers. To find out your state options, go to www.seniorlink.com. This is a great link to get resources for you. You can find out about options that are available and things that may not be available for you so you can plan ahead of time. Cancer Care provides cancer-specific support groups for spouses or a partner with cancer. The group is led by an oncology social worker. Often members of the support group can lead you to resources as well. So that's Cancer Care. Cancercare.org is another organization to go through. Next slide. So reframing the narrative. I'm going to repeat this because it's so important. When you are caregiving or care partnering for a loved one, so many emotions surface. I experienced frustration at not feeling like I could do enough to support my husband. And unfortunately, that doesn't go away when that person is deceased. A lot of times you carry that guilt and that frustration with you. I had feelings of guilt, isolation, fear of unknown, and periods of depression. And if you can understand this and recognize it and get the help, it's going to help your health as well. When I realized that I could call upon friends to help and to talk to someone, and realize that I didn't want to be anywhere, I realized at that point, I didn't want to be anywhere else. Getting that respite, getting that other voice, getting those other people to help me and realize that I wasn't alone, someone just to come in and walk the dog or stand outside the door and talk to you for a few minutes, really goes a long way in how you feel about caregiving. And it also, surprisingly, even though you might not be aware, that person you're taking care of, they benefit as well. A lot of times they see the stress that you're in and they don't want to say anything because they feel like they're feeling guilt, isolation, depression themselves, and to feel like they're taking your time and that you're caregiving, you're taking care of them. They feel guilt and frustration and desperation as well. So if you find someone to help, even some of the small chores like, taking the dog for a walk, somebody watering the grass, taking care of your flowers, things like that, goes a long way in freeing your time up and allowing you to spend more quality time for the person you're taking care of. I became a care partner instead of a caregiver. Consequently, my husband didn't feel as much like a helpless patient, and his attitude changed as well. I felt less stress. I became more grateful for the experience, and it led to more quality of time. Very important, because you're not going to get that time back. Next slide. In summary, I know this went kind of fast. I hope you have questions, because I'd be glad to answer them from a personal perspective as well. Caregiving or care partnering is difficult, as you all know. As our population ages, the need for caregiving resources are going to increase. More and more children will likely find themselves in caregiver positions. And how is that going to affect them if they are under age 18, prior to being ready to go to college? How's it going to affect them in their studies? That's something that's really, really important. So I really stress that you find other options as well to try to take care of your caregiver, especially if it's a chronic long-term illness. It's very difficult to expect children to be able to manage these for a long period of time without giving up on themselves. Seek out help and financial alternatives before this becomes a reality. Again, check local, state, and federal resources that may be able to help. And don't forget to ask for some help from friends and family. They can help manage bills, make calls, pick up medications, walk a dog, pick up groceries, or make a meal. Keep an eye out or sit with the recipient while you attend your own needs. Look for alternative and creative ways to get paid for your services. And another thing that I found was very helpful, instead of being in a house where you're taking care of that person, it was, in my case, it was my spouse, and it's quiet, you're walking from room to room, instead of just having that television on, sometimes it helps to have uplifting music. I found this very relieving. I found myself being able to sing along, and it really lifts your spirit, and it lifts the spirit of that person you're taking care of as well. So I would love to field some questions. If there's anything that I can do to help, any resources I can do to help find for you, please let me know. We have any questions?
Sorry, it wouldn't let me
that's okay.
turn on my camera. No questions yet. Ironically, while you were talking, I got a call from the hospital to make a major decision for my grandma who's in the hospital right now. So pertinent topic and never leaves you. I think that's something that's important to recognize is, when you're caregiving, it doesn't matter where you are, it always stays with you. One thing that I had a question with when it came to the FMLA, do you have to be legally married to the person or prove bloodline? Is that correct in order to get that FMLA? I know when it comes to marriage, you have to be legally married. If you're the child, do you have to give a birth certificate? How does that work?
Differs depending on what the employer asks. And it depends on state to state. But generally for FMLA, a spouse can, or a domestic partner, and a lot of respects can as well. Again, I would check with the employer. There are a lot of employers who are recognizing domestic partners. If you are a child of, like, an adult child taking care of a parent, some employers give leeway to help with that. And again, I would always look at this as a case-by-case basis. Talk to your employer. If your employer knows what the situation is, especially if it's a chronic long-term illness, and it could be, a person could be fine one day or 1 week or 1 month or 1 year, and the next year they're sick again. If the employer knows that, especially your boss, and you are a good employee, you volunteer maybe to work extra hours during the week, or if there's any additional things that come up that you want to participate in, knowing that you may have to ask for a favor later on down the road, is well worth it. Additionally, employees can ask if there's any what they call a bucket, a pool, where people have volunteered vacation days that they cannot roll over. Ask about those, because a lot of times people put those in a pool and it can be used for people who need to take time off paid.
Awesome, thank you. Another question here is a good one. How do you cope when the patient does not cooperate with the things you believe are medically beneficial for them? How do you cope with someone who wants to give up when you are not ready for that? I share that question.
That is a very difficult one. I think what's really important is I think our country needs to get we need to talk more about life and what that means, and quality of care. And it's unfortunate that everybody wants to live forever, but we know that's not going to work. And there are some people who realize that if they get to a certain point, that they want to die with dignity, and they don't want all of these other things interjecting. And so anytime it comes to these things, it's very important to talk about these ahead of time, before a person is on a lot of medication, who can't think rationally, and they make sure they do their estate planning, and they have those powers of attorneys, those durable power of attorneys, those living wills, all of those things in place, because eventually it may come down to that for all of us, right? It's very difficult when you have a difficult person. I would encourage you, when the person who asked the question says when they thought was in that person's medically best interest, is that what the doctor is saying? Again, if you can get the support of the doctor, and that's what the doctor is saying, then see if there's a social worker. Sometimes a person's going through depression. It could be short-term depression. My husband did that. And it's unfortunate, a lot of men, and I say this because it's true, statistically proven, I don't want to just be mean to men, but men have a tendency, and culturally we have allowed this or forced this on men to realize that they feel that they can't ask for help, and even if they're financially or emotionally stressed. So that just hurts their health as well. So it's very important to recognize when a person's not themselves, and recognize it could very well be a short period of time that they're going through this, and seek out help from the doctor. They have social workers that can call and help you with this, or somebody can talk to that person. And when you go to the doctor, mention this, maybe send a note ahead of time and say, this is something we need to address when you go in. I understand it's difficult. It's very difficult. And one day the person can be on the top of the world, the next day they can be down. It's whenever a person's ill and it's a long-term chronic or maybe a terminal illness, they're having to come to grips with mortality. And sometimes we as a layperson looking at this, we're coming to grips with mortality. Sometimes you may be grieving ahead of time, and that's natural, but you're also looking at your own mortality and how you want things to happen with you. So there's a lot to unwrap with that. But I encourage you to talk to the doctor and talk to social workers who can help intercede on your behalf when it comes to the medical care and what's in the best interest of that person.
Yeah. Outside of the social worker, what other kind of therapy do you recommend for caregivers?
Support groups. There are support groups for caregivers. And support groups will give you a lot of resources that you probably wouldn't know. They can tell you about local people that they've worked with. Word of mouth is always really big, especially if you're going to have somebody come into your home. If someone's used a person before, whether it's somebody through their church who volunteers to do this for people, word of mouth is wonderful because you already know how that person cares for people. They've experienced it themselves. I think caregivers have a tendency also to, like I said before, to put their own needs aside, and they may need some help as well, emotionally. And right now, there's great resources online where you don't have to go into to talk to a doctor, where you can sign up your insurance. I'll take your insurance online, and you can talk to a doctor or someone, a social worker or psychologist, someone to help you along the way online. And your insurance will generally pay for all of those.
Would you ever recommend grief counseling for somebody that's an active caregiver, kind of grieving almost the life that they thought they'd have? You do know what I'm trying to say?
For the caregiver or the recipient?
Both, probably.
You know,
I know you're not a mental, expert, but just from your own experience and from what you've seen.
What I was going through, I wished that I had sought out help. Would have became very difficult. I didn't. Of course, you shoulder, as a caregiver spouse, a lot of times you shoulder everything, and you don't want to put that responsibility on anybody else because you know that person better than anybody. But I think counseling goes a long way, not only for the caregiver, but the recipient as well, because it helps the recipient put things in perspective. Opens up dialogue for both people, because a lot of people have a tendency not to talk about things that need to be talked about.
Right.
Planned for everything needs to be planned about, not just for that person, a recipient who's ill, but the entire family. So I encourage talking to a social worker, whether it's 1 or 2 visits, it doesn't matter. But at least reach out and find out if there is help out there. And again, it can be done online. You don't have to go out to someone to have that done.
Yeah.
I encourage, it's going to help you put a lot of things in perspective.
I agree. Okay, another question. This kind of goes right along with what you were saying about some people struggle to talk about things that need to be discussed. How best can you bring up the need to get our finances in order, to include a will without your loved one being upset? If this person brings it up to their loved one, that they don't believe is going to survive for very long. In this case, it's the husband, very much in control of finances and does an excellent job, but when he's gone, the person that remains has no idea how to handle any of the finances. They do have power of attorney and a living will in order, but I think this is an excellent question, an excellent example of things that are really hard to talk about. And even as a financial program advisor, what do you kind of say to couples that are in this situation?
Wow.
Yeah.
It's a very difficult one. And I want to share my experience. My husband was very, very hands-on with a lot of things. I mean, I did it a lot, and I said, I just didn't want to do all this stuff. And I started, we farmed out what we wanted to take care of. And my husband was one who 3 months before he passed, he was down in our gym. We had a gym at home. He said, I'm going to get back in shape. And there's a lot that goes on. There's a lot of not facing reality. There's a lot of that for everybody. And again, our culture and our country is, we don't talk about death. We don't talk about illness. We don't talk about, what ifs and what needs to be done for families. There are organizations that actually help with bringing these topics up. There's actually called, I know this sounds horrible, but there's called death dinners, and they're becoming very popular, where people will, families will come together, they bring a potluck, they sit down and eat, and they talk about how they want to plan for their family members, for themselves and for their family members. What I found to be helpful, and other people have as well, is when you have this topic and you need to bring these things up, making sure the will and estate planning and budgeting and finances and everything is done. Believe me, that person who's ill is thinking about it. They don't want to put another burden on you. A lot of times it's this to talk about it, and they don't want to make you afraid. And and unfortunately, a lot of men in the 60 or 70 age category were taking care of all the finances. And that's just the way it was done, because a lot of times they're the ones who were working, the women weren't in the field working. And so a lot of men managed all the finances. It becomes very difficult to get them to say, you know, we need to do this, we need to do that, and to allow his wife to become involved in knowing how to take care of things, so they'll know how to take care of things prior to a person passing. If you can get family members like children on board, or sometimes the wife or the other, or the husband can say, you know, I'm thinking about what I need to do if something were to happen to me. I'm taking care of you. But what if something happens to me? I'm looking at everything we have to make sure that if something happens to me, you're still going to get the care you need. Sometimes if you talk about your own needs and what you want to do, a lot of times that'll bring the conversation up. I found that most helpful, or bringing in a daughter or son and just having a get together and say, we need to talk about this, and have them say, this is what we're doing for our children. Our children may be young, but we're already planning for what ifs.
Right. And I love the framing of that too, because I think lots of the fear comes from, I'm going to be here. I'm going to be here. Don't worry about me not being here. It doesn't even have to be, I need to figure this out in case you're not here.
Mhm.
It can be, in the rare case that something were to happen to either you or I want to make sure that everything's in order. You know, it takes less pressure off of them and more cohesive sharing of responsibilities.
Right.
Which,
and it doesn't have to, I'm sorry.
way easier said than done. Way easier said
Right.
than done.
And it doesn't have to even look at a thing where somebody's going to die. It could be in the event I became disabled.
Mm.
You know, how are we going to take care of that? If I'm in a hospital or I'm in a car accident and I can't make arrangements for myself, we need to get these things settled ahead of time, so there will be less stress on you. I'm telling you, it makes a huge difference. My husband, and I didn't realize, I mean, we knew before we got married how we wanted to be if something were to happen to us, one person became ill. And you need to make sure when you're doing this, that when you do estate planning, that the person who's going to manage a lot of those things, like the decisions in the hospital, the care, that they're actually going to follow through with it. And it's the most difficult thing to do. But I knew what my husband wanted. But when you sign that DNR and you know that that's it, it's like an out of body experience. But you know that you're following with your loved one's wishes. And that does help, just to know that you're doing, because I would want somebody to follow what I wanted.
Yeah.
But again, planning makes all the difference in the world. The last 3 weeks before my husband passed, you can tell that there was something coming, right? We knew something was coming. Even though he was up walking around doing his own thing, we knew that somehow something was coming. And I wanted to talk about it, but I didn't want to talk about it. But one night we were getting ready for bed, and he sat on the chair in the bedroom, and he sang the song to me, John Legend's song, my head's underwater, but I'm still, you know, that song he did for his wife, my head's underwater, but he sang that for me for 2 hours straight. And it was almost like he was trying to make it a point. And I realized that we need to wrap some things up, because he's making a point of something. Sometimes you take clues, sometimes there's clues, and you can't pass up on those clues. And the conversation is difficult for everybody. I need to make planning for myself. I know better. I'm a financial advisor. There's still some things I need to change and correct, and we should not put these things off. It's important. It'll less stress later on.
Yeah.
Less guilt, less stress later on.
Yeah. Steve mentioned it's, you know, better to, from his experience, it's better to allow friends and family members to help find a way in which they're comfortable. Nothing worse than forcing someone to help in a way that they resent.
Right, because then everything is shut down. Yeah. Absolutely right.
And then Nancy wondered, is negative mortgage a way to manage financial stress, and what would be the alternative?
So that she must be talking about a reverse mortgage. It's probably a reverse mortgage when if you're in a home and you have equity in it, or you may have had the house paid off. One thing to look at, but you got to be careful. If you have a surviving spouse, if you go down and spin that house down, that spouse has to leave, right? That could be a possibility. Again, I would talk to a financial advisor with that, I mean, I can't just say for any, I would talk to a financial advisor. That's a huge one. You got to look at taxes. You got to look at, surviving spouse. You got to look at if you need to do a spend down, Medicaid. I mean,
Yeah.
there's a lot wrapped up in that question.
Another question I had, when it comes to palliative care or even hospice, what's the caregiver's role when it comes to those kind of things where there's professional care from a hospital in the house? Where do you see responsibilities from that care partner coming into play?
It's really interesting because when hospice comes in, they're not there for the entire day.
Mm.
So that caregiver is still taking care of that person for the majority of the day. So that doesn't change. The hospice is there to make that person comfortable. And a lot of times that means medication or to counsel family members on what's going on. But they're not sitting there watching things, helping from day to day. So that caregiving is still in place. Palliative care is very much the same way. A lot of people think that palliative care is like hospice. Palliative care isn't. Palliative care could be a person who's had a lot of surgery, major surgery, and it's going to take them a while to get on their feet. And they make them comfortable. They help with a rehabilitation. That's completely different from hospice care. Hospice care is when a person has decided they're not going to do anything to prolong life into like chemotherapy, unless it's to make them comfortable. They're not going to do anything other than that to make them comfortable. And there's a period of time when they know that person's not going to live. Palliative care could be just a short period of time to get the person on their feet. It doesn't mean that that death is imminent at all. So if there's caregiving, that's going to be still your person. You're going to be the one doing the caregiving.
Right. Yeah. They're not going to be there all day taking care
Right.
of that patient.
Exactly. Unless you paid for someone or found help coming in to help care for that person. And again, some insurances will pay for that. Look at Medicare. If a person's coming from a hospital into a situation like that, a lot of time that care goes on for a period of time.
Interesting. All right. Well, those were all of the questions. I think that was an excellent presentation, excellent discussion. I'm really grateful for all the questions that were asked today. I'm going to finish up with just a couple of our outro announcements and then we can finish today. But thank you, Diahanna, for your education and also for your personal experiences that you've shared with us today. I really do appreciate it. You can join us next month on August 9th. Normally we meet the first Tuesday. This will be the second Tuesday of the month. And we're going to be hearing from Diahanna about how to capitalize life insurance to pay for your care. I used to think that life insurance was just something that happened after somebody had passed, that money was accessible, but we're going to be learning how to use it as a resource next month. You might be interested in other myeloma community events we have upcoming. On the 6th is our tomorrow night is our HealthTree Moves for Myeloma chapter. We're going to be discussing how to find mental strength through physical activity. And then the 12th at 7:30 p.m. That's actually 6:30 p.m. Pacific. I'll make sure to change that before we send these out. But the 12th at 6:30 p.m. Pacific, excuse me, is our SoCal Myeloma Community Chapter. We're going to be talking about how to live with myeloma while not dying from something else, making sure that we have a cohesive care team that's looking at that's looking outside of our myeloma to other parts of our body so that we don't neglect our health in other areas. And then Thursday, July 14th at 1 p.m. Eastern is our stem cell transplant chapter. We're going to be discussing what diet we should follow after stem cell transplant. The link to sign up for any of those events and even more events I did not mention today is found at the bottom of the slide and will be included in that follow-up email with the resources within 48 hours of the event's conclusion. Another thank you to our sponsors, without whom this is not possible: Bristol Myers Squibb, GSK, Genentech, Janssen Oncology, and AbbVie. And a big thank you again to each of you, to you, Diahanna, for our audience today for an excellent discussion. We hope that you have a great rest of your day, and thank you for joining us. Take care, everyone.